Have you ever had an injury or maybe a surgery, and long after everything on the surface looks totally healed, there's still this strange, nagging pain? It can be so confusing, right? And honestly, a little isolating when your body looks fine, but it's still sending out these pain signals. Today, we're going to gently unpack one of the reasons that can happen. So many people find themselves asking this exact question, and it's frustrating, feeling a very real pain without a clear, visible reason. I just want to start by saying you are not imagining it. There is very often a real biological explanation for what you're feeling, so let's explore that together. Okay, so to really understand this kind of lingering pain, we have to look at what happens inside the body when a nerve gets damaged. Our bodies are amazing at healing, but sometimes that repair process can just go a little sideways, creating a whole new problem while it's trying to fix the old one. What can end up forming is something called a neuroma. Now, I know that word itself can sound a little intimidating, but the most important thing to know is that this is a non-cancerous growth. It is not a tumor. Really, you can think of it as just a disorganized little bundle of nerve fibers. It's the body's messy but well-intentioned attempt to heal a nerve that's been cut or hurt. Picture this. A healthy nerve is like a perfectly paved highway, letting messages travel super smoothly from point A to point B. But when that highway gets cut, the body sends out this repair crew. The nerve tries to regrow, sending out these tiny little sprouts, kind of like the roots of a plant searching for soil. The problem is, if those sprouts can't find the other end of the nerve to reconnect with, they can just grow into this tangled, chaotic knot. And that knot, the neuroma, can become really sensitive and start firing off its own pain signals, completely out of the blue. So what causes that initial damage in the first place? Well, it can happen in a few common situations. Surgical incisions are a big one, especially after procedures like a mastectomy or certain chest surgeries. A traumatic injury, like a bad bone fracture, can do it too. And sometimes even just long-term pressure or entrapment on a nerve can set the stage for a neuroma to form down the road. That brings us to a really important point. How do you and your doctor actually figure out if a neuroma is what's causing your pain? Pinpointing the source is everything. It's the first step toward relief. And the process is kind of like a careful piece of medical detective work. First off, it's about the kind of pain you're feeling. Nerve pain or neuropathic pain just feels different. People will often describe it as a burning or tingling or a sharp stabbing sensation. Sometimes it's like a little electric shock. You might also have something called allodynia, which is where a super light touch, like your clothes brushing against your skin, feels painful. Or you could have hyperalgesia, where something that should be just a little bit painful feels incredibly intense. If any of that sounds familiar, it's a really big clue. So, during an exam, your doctor is going to start by just listening, getting a really detailed history of your pain. Then comes the physical part. One of the key things they'll look for is something called a Tinel's sign, and that's just a fancy way of saying they'll gently tap over the area where the nerve might be. If that tap brings on that familiar electric tingling pain, well, that's a really strong sign that a neuroma could be the culprit. And for neuromas that are deeper in the body, an MRI or an ultrasound can often let us see that little bundle of nerves directly. All right, so once a neuroma has been identified, the whole focus shifts to calming down that overactive, disorganized nerve tissue. The goal is pretty simple. Quiet down those faulty pain signals and get you back to doing what you love. And the good news is, there's a whole toolkit of options we can use, and it's definitely not a one-size-fits-all kind of thing. A modern approach is what we call multimodal, which just means we combine different strategies to get the best result. This could mean using medications like certain anticonvulsants or antidepressants that are specifically good at calming down overactive nerves. Then there are interventional procedures like targeted nerve blocks that aim to interrupt the pain signal right at the source. And, this is so important, non-medication therapies like physical therapy, massage, and dry needling play a huge role in improving function and helping the body heal. One of the really fascinating options is called neuromodulation. It's based on something called the gate theory of pain. Think about it like this. When you bump your elbow, what's your first instinct? You rub it, right? That rubbing sensation sends a different, non-painful signal to your brain that actually competes with the pain signal, and it can kind of close the gate on the pain. Neuromodulation works on a similar principle, but in a much more sophisticated and targeted way, using gentle electrical pulses to close that gate and stop the pain messages from getting through. Now, I should mention that in some specific cases, when other treatments just haven't brought enough relief, surgery to actually remove the neuroma can be an option. It's something that's always approached very carefully.
because there is a chance the neuroma could try to grow back. So it's always a very thoughtful decision made between you and your whole care team.
And this all leads us to the most important part of this whole journey, recovery. Finding the right treatment is a huge step, but the path forward is also about rehabilitation and giving you the tools you need for long-term relief and well-being. And when we talk about what recovery looks like, there is a very good reason to feel optimistic. In fact, the research gives us a really encouraging number to hang on to. A key long-term study that looked at outcomes after surgery found that a full 90% of patients either improved or stayed stable. That means only a very small number continue to have issues. That's a powerful statistic. It really shows that for the vast, vast majority of people, taking action can make a real positive and lasting difference. But here's the crucial part. What the research shows again and again is how people get to that positive outcome. And the secret ingredient is this. Lasting success, no matter which treatment you choose, is almost always built on a foundation of ongoing physical rehabilitation. Your active participation is the absolute key that turns a medical procedure into long-term relief and a better quality of life. So if any of this story sounds a bit like yours, please know that there are clear paths forward, and you really don't have to walk them by yourself. The journey to feeling better often starts with just one single step. And maybe the most powerful first step you can take is to simply start a conversation with a healthcare provider who will listen to your story and help you figure out what comes next. Thank you so much for joining me today.